Well, a medical detective is really looking for deep clues about underlying unifying issues. The average person that comes to see me has kicked around the medical establishment for quite some time without finding help for their problem. Perhaps they've been referred to multiple specialists. I actually have patients that have seen 150 doctors by the time they come and see me. And there's just what's lacking is someone that is taking in the information from all of these specialists and synthesizing that and looking for a underlying kind of set of issues that are responsible for the different manifestations of their health condition. So I use a variety of different ways of gathering information when I meet somebody. The most important is a tool that's old, that is unfortunately no longer relied upon quite as much as it should be in medicine, and that's the history. I think it's part of the constraints of the way medicine is practiced in this kind of managed care situation and short appointments. It just doesn't lend itself to deep dive with people. But what I do is I spend sometimes 2 hours talking with people and really going into great detail about their history. When was the last time in their lives where they felt well? How did they eat as a child, and what was their life like? When did their health change? Did it change all of a sudden, or was there a gradual decline in their health? Or was it punctuated by drops and then later another drop and another drop? And what was going on in their life at the time of that? Were they under tremendous stress? Had they just traveled to foreign country? What were they eating? Were they in school? Were they in a difficult relationship? So I'm looking for all of this incredible level of detail when I'm talking with people and just trying to harvest clues about their situation. I also find it interesting to ask about every aspect of their health. I'm asking about their gastrointestinal function and signs and symptoms related to endocrine imbalances and even their genital urinary functioning and their mental clarity, everything. And so once I've done that, then that kind of guides my workup. And I do some really deep and sometimes esoteric testing. I send blood all over the United States, stool samples, sometimes salivary samples, urine samples, and send outside of the United States as well, to Europe and places like that. So I do testing that a lot of people don't do. And then I do some energetic testing. And I actually have found this to be indispensable for helping me to understand what's going on with a person's health, and I use it as a tool to guide the other type of workup that I'm doing. So for example, when someone comes in, whether they have, let's say, an autoimmune disease, a neuroinflammatory process, or a neurodegenerative disease, or a chronic fatigue syndrome, or something like that, you'll be surprised at how often someone has a dental component to that. Someone might have an infection at the site of an extracted wisdom tooth or at the site of a root canal, and they may be totally unaware of that. They may not have any pain in that site. And so I'm not about to send every complex patient to a biological dentist for a three-dimensional CAT scan, but if my energetic testing suggests that there may be an issue, I would be more inclined to send those particular people to the biodentist for a 3D CAT scan. And very often it bears out in that type of testing. And then again, treating that can have a profound benefit on their overall health situation. But that's just one example. So anyway, what I'm doing is pooling all of these data streams, as well as paying a lot of attention to my intuition and the feedback my intuition is giving me, and the feedback I'm getting from the subtle clues of someone's body language, or just the way that they language their issues. Just how they talk about it reflects kind of their mindset about it. So I'm looking for subtle kind of clues about psychospiritual underpinnings, and even, a person's mindset that could be contributing to their situation, or, limiting beliefs that just could be creating dissonance in their system. So regardless of what someone has, if they have a complex situation that's been difficult to diagnose, you need to be pulling information on a variety of levels, synthesizing those, and looking for the underlying issues that are at play with that situation. And usually it's a constellation of factors, from underlying infectious disease, microbiome imbalances, diet, food incompatibilities. There's almost always a hormonal imbalance piece in complex people, and immune disorders related to hormonal imbalances and nutritional deficiencies. And then there almost invariably in every health condition is a psychospiritual component that needs to be kind of teased out, brought to light, and unwound. So that's what it means to be a medical detective.